Prior to PRISM being set up, it felt quite lonely in practice, so I'd either see a patient at home or in surgery, and
I think one of the main issues that we have is referring to other professionals, because there's a lot of other people involved in their care. I'd have to make a referral through whichever process they had.
I felt isolated, that there were specialists at hospital or specialist teams out there somewhere, but I didn't have easy contact with them.
The main concerns that raised was that you spend hours on the phone or completing paperwork in order to make that referral. There's then maybe a wait. I mean, for our services in the community, it's 14 to 28 days wait.
All these things took time, and meanwhile the patient's waiting for these services to start,
which is very difficult for them. And then they've got a stream of different professionals knocking on the door asking the same questions, because we don't always share information across the agencies as we should do. Instead of passing the information on so that people don't have to ask the same questions, the poor service users are sat there saying the same information over to like 4 different people, and it can be very frustrating for them and for us as well.
The problems are going to be in vastly increasing numbers of patients with long-term conditions and multiple long-term conditions. That number is just going up and up and up as every year passes.
At the moment, often practices work very reactively, so you're caught out sometimes by patients with big needs.
Up until PRISM started, we've been almost fighting fires with our patients. So they come in crisis, and we have to react and try to do something to help them.
But also when there's urgent care, a lot of GP appointments, a lot of same-day appointments are often driven by patients who've got long-term conditions, who need help. And I think our clinicians are often frustrated that they can't do as much as they'd like for their patients and do enough in their homes.
That's the wrong way round to do medicine. What we really need to do is identify patients before they reach crisis, years before they reach crisis, and start to improve the care that they get, the understanding of their illnesses, and basically give them a better quality of life. The biggest change and key benefit of PRISM is lots of different clinicians, care workers working together as a team, as a close-knit team for the benefit of patients, which has not been done before, and that really makes a difference to individuals.
I was really excited to be working as part of a new team, because clearly there were gaps in the service that needed to be filled with the right professionals, and I felt that it was going to be positive for the patients. Having done this job for quite a few years now, I could certainly see where the gaps were, and I think that, you know, all being located in the same building was going to be a major advantage for all of us, so I felt really positive about all that.
I thought it'd be an exciting new challenge for myself, and I thought it would be a good idea for service users and for professionals to be able to work together in the same team and have access to each other more easily.
I think it's made a major difference to the way that I work, because all the health professionals are in one room. We can have informal discussions about the patients that we see, and those informal discussions can save so much time.
The other really helpful thing is that then we can go out together. Like, we do a lot of joint visits. I go out quite a lot with Faye, the mental health nurse, and Lisa, the community matron, and it means that the assessments can be taking place together. We can be doing our assessments in one visit. It's really interesting to have different people's opinions in the office, and it can be really helpful because you're looking at people in a holistic way, and everybody's looking at the different aspects and then talking about them, and it makes my assessment fuller and gives a rounder picture of the whole person, and then it makes it easier to support them and to give them the services that are really going to improve their lives and make things easier for them and prevent them from going into hospital.
I have found that it's not only the patients who need help, really, it's the carers as well, which wasn't identified, I think, at the beginning, but like I say, the role has evolved so much within these few weeks that you have to be willing to be flexible and evolve with it.
Well, importantly, the carer is the focus in this as well. So what they have to say is heard. Also, what the family has to say is heard.
What's different now and what is really lovely is that I know the team, and I can say to a patient, look, a lady called Faye is going to come round and she's going to help you with maybe some of the anxieties you've been experiencing, or a lady called Michelle's going to come and see if there's any extra help we can give you at home. And I know these people, and that gives confidence to my patients.
It can happen within a week that things have changed for them, which is lovely to see. It makes it quite humbling to go and see that you have made a difference.
I just think it's fantastic service for the patients, and it's a really good way of working in a totally multidisciplinary way.
So for me, PRISM is important because it's not just the health professionals who are within the team, but they have recognised and embraced the fact that there are services outside of the health profession that would actually support. It's the holistic approach that I like.
There's a lady, her name is Pam, and she's given me permission to talk about her. And she said to me that before PRISM, she felt she didn't want to bother us. And she said, it's just you, doctor, and I don't want to bother you because I know how busy you are. Now she knows that I'm part of a bigger team. She feels supported, and she hasn't been in hospital for months now. She's really well. She's the best I've ever seen her. And she says that she doesn't feel afraid to ask us for help, and that's just brilliant.
I think for the process to work, it doesn't work with just one party or one GP practice or one organisation. The whole point is to integrate care for patients, to pull information and resources and center them around the patient themselves, rather than around the organisations and how they want to work. So for that to be successful, it's essential that all organisations partner together, as they are doing, and work well and put the patient at the centre and put aside their own priorities and ask, what does it mean to put the patient first, to provide services and care in a way that will best benefit our patients? And that's exactly what we're doing with PRISM.
Importantly, I think we use the key phrase, the mantra, which is no decision without you, and that's the key part of this. The patient is at the centre of their own care. So healthcare, local support, voluntary support comes to them. So it's a total change to what healthcare will be in the future to what it is now.